Well, as promised, we have here the opportunity to discuss more about the patient history, the specific symptoms. So we're using this case that we imported a moment ago, and this is of an adult. The date of birth, we don't really know the name, but for the purposes of this, we decided to make this person an adult. And so they get an adult set of symptoms. Those are essentially memory difficulties. If they're over 50 and they show signs of memory difficulties, then a dementia discriminant can be run. And also depression. Depression is another discriminant that can be run if they do not have any other exclusion factors. Like, for instance, if they didn't have a previous head injury or they don't have any neurological epileptic symptoms like convulsions or other neurological symptoms, no history of drug abuse or alcohol abuse, then depression can be checked on any adult. If the adult is over 50, whether this is both of them are checked or not, it will cross-check against the dementia qualifiers, classifiers. Okay? That is just a safety mechanism. If over 50, everyone gets run through the dementia, whether they are just complaining about depression or not. Now, if any of the exclusion factors, for instance, the convulsions or head injury or something like that, if any of those are checked, these symptom specifics will simply not run. They won't run because we don't have data sets of people with depression and head injuries. That was an exclusion factor in the original study, and so it has to be a factor for exclusion in the actual classifiers itself versus a 34-year-old. Notice this. I go back to patients again. And this time when we select the patient, we're going to change the person's age. It is a hypothetical after all. We're just going to make that person an adult, 2005, that's a 12-year-old, okay? Now the symptoms are different. We still have different factors that can be used for giving disclaimers or language of a disclaimer or else exclusion from specifics. If excluded from specifics, it still will run normal versus abnormal, but these are those, that top group. And then we have three symptom-specific classifiers, discriminant classifiers. That's learning disability, or known as LD. And LD has been considered comorbid with hyperactivity, so if both are checked, it will just check for hyperactivity. But that is hyperactivity, attention and impulse control problems, also known as ADHD. And there's also a symptom set that is descriptive of autistic spectrum disorder, ASD. If both of these are checked, there is enough similarity between them that it will run a comparison against one another to find out if they're both affirmative. First it runs them individually. If they're both affirmative, then it cross-checks them against each other. That's hyperactivity and autistic spectrum disorder. But let's say you picked these two, and then you also had, let me say, convulsions. Because there is a history of convulsions, no symptom-specific classifiers will be run. So that's what happens with an exclusion. Instead of the specific symptoms, it will just look for general, normal versus abnormal. And the same goes for if no boxes are checked, it just runs normal versus abnormal. Well, that's how you can understand and read the symptom checklist.